I think it goes back to your culture, and it goes back to educating your therapist. So the first time that, that therapist comes to you and says, "Hey, I don't think this patient needs this," then we look at, all right, what was your outcome with that patient? How many times did you see that patient? Did you keep that patient in our clinic for 40 visits and then send them to a spine doctor to have surgery? Like, how is that managing the cost of that patient's care? We see that when we have an accurate diagnosis, the cost of care actually goes down because we don't keep those patients forever. We make good referrals out early when they don't get better. Let's use our cervical radiculopathy. You have a therapist that's treating that patient. If they're past 12 visits from me and that patient is not significantly better, they need looked at. They need another set of eyeballs. I'm not saying you have to discharge them, but make an appropriate referral. Get some additional studies done on that patient. So I think when we actually figure out that, man, we have the ability to accurately diagnose these patients, the cost of care actually goes down for that patient. And we have a culture where if you're seeing a patient for 40 visits and they have surgery after that, like that's an issue for me. That is not utilization of good care for that patient's money.